Good afternoon, Mr. Parker. How are you today?
I'm well. How are you?
I'm good. My name is Emily Butters. I'm going to be your student physical therapist today.
Okay.
So I noticed that you were diagnosed with ALS a couple months ago, and that it's been affecting the way that you're walking around and a little bit of your balance. Is that right?
Yes, it has.
Okay. So what I'm going to do is I'm just going to give you all the strategies and techniques that I can to help you to be able to continue to participate in your everyday life, whether that be working on your balance, working on your walking, in and out of the golf course, all those kind of things that you like to do. How does that sound?
That sounds good.
Okay, so this device that I have put on your leg, we're going to do kind of a trial run today. It's called an AFO, and it's going to help to kind of fix some of that foot drop that you've been experiencing on your left foot. It's just going to help you to be able to bring your foot up off the ground so that you can walk and decrease some of those falls.
Okay.
Okay, so we're going to go ahead and get started. I've set up a chair on the other side of the room for you so that we're going to stand up, walk across the room, sit down, and then we're going to see how it goes. I'm just trying to see how this AFO feels, if it fits right, if you think that you'll be able to use it later on. How does that sound?
That sounds good.
Okay.
Let's give it a try.
Okay, so go ahead and stand up for me. Good. How does the fit feel right now?
It feels good.
Pretty comfortable?
Yeah, it feels like tight and like it's keeping my foot from falling down.
Okay, perfect. Go ahead and walk over towards the chair for me.
Okay.
Good. And you can take a seat. Good. And that felt good as you were walking over here?
Yeah, I feel like my hip's still kind of coming up, like I got used to it,
Mhm.
but it definitely helped my foot from falling down.
Yeah, I think you kind of developed a little bit of a habit having to compensate a little bit for the lack of strength in your foot, but hopefully with this AFO, we're going to be able to improve your walking as you go about. So how do you feel fatigue-wise? Are you a little tired right now after walking that 15 feet?
I felt like my body got a little tired towards the end, but not as tired as I get walking on the golf course or doing things with my wife and kids.
Yeah, so again, this is just kind of a trial run, seeing how it fits, and hopefully as you get used to it, you're going to be able to conserve some of your energy as opposed to letting your foot drop.
Okay.
So while we're resting, I'm just going to talk to you a little bit about some more energy conservation techniques that you can use throughout your day. So what would you say your sleep schedule is like?
I go to bed around 10 and get up around 7 or 7:30 with my wife and kids. But I usually get a little more fatigued or tired around the afternoon, noon time, and so I've been like taking naps trying to like decrease my fatigue.
Just because of the disease that you have, it is going to increase your fatigue levels throughout the day. So it is really great that you take a nap as long as you decrease the time that you're doing it, because you know, if you take a couple hours of a nap a day, you're not going to be able to sleep at night. So it's really good that you have a good sleep schedule at night and you're able to sleep.
Okay, how long should my naps be?
Your naps can be about 20-30 minutes max, kind of like a power nap. It should re-energize you for a little bit until you're able to go to sleep at night.
Okay.
Okay, and then another thing I can tell you about is just pacing your day. You're a super active guy, you like to golf, you like to play basketball with your friends, but doing those things in moderation and making sure that you're taking those rest breaks when you need is super important as well.
Okay.
And then one more thing, your nutrition. Again, you're super active, you're moving around throughout the day, so just being sure that you're getting that calorie intake that you need throughout your day to give you the energy to be able to do the things you want.
Okay.
Sound good?
Yes.
All right. So now we're well and rested. We're gonna go ahead and stand up and walk back over there.
Okay.
Okay, good. Can you stand up for me? Perfect. Good, and that looks great. So what do you think about using the AFOs in the future?
I think it'll be a good device to help me like participate more in my life, and it'll help me overcome the things that are holding me back right now.
I agree. I think it looks really great. You're compensating a little bit less in your hip, and hopefully that'll help to decrease some of your pain around your body. Had a little bit of a break after we started walking across the room. So next we're going to try this exercise on the bike.
Okay.
So it's kind of a 2-in-1. We're going to be working on both your balance and some of your leg strength at the same time. It might sound a little wacky in the beginning, but I promise it'll be a good one.
Okay.
So what you're going to do first, I'll go ahead and demonstrate just on the other side here. You're going to be standing on one leg, and then your other foot is going to be right here on the bike. You can hold on with your arm if you need the help, but we're working on your strength using your quads and your glutes in this leg, and then we're working on your single limb balance on the other side. So all of this is going to help you to be able to walk, to have the strength to walk on one side and then keep your balance as you're swinging your leg forward on the other side. How does that sound?
It sounds really good.
All right, so go ahead and stand up for me. Good. And then you can hold on with your right arm right in here. Good. Let's get your foot right in here. Good. I'm going to tighten that for you. Okay. There we go. Okay. So, keeping your balance with your other arm if you need it. And go ahead and bring this foot all the way up. You're going to take a pause at the top and then push really hard to finish the circle there. Good. There we go. Pause at the top and then push down. Good. Pause at the top and then push down. Good. How does that feel?
That feels really good. It's definitely making my muscles tired.
Yeah? Okay. So we're going to try to go for about a minute, just pausing at the top and then circling our way through. If you need a break before that, let me know and then we can take a break and sit down. Okay. Good. Let's go for just a couple more and then it'll be at a minute. Good. Okay. Last one. And then go ahead and pause at the bottom down here. Good. You can take your foot out. Good. And then take your foot off there and then we can sit back down. Okay. So naturally we want to progress to being able to do a lot more time and a lot more reps. But we're going to go ahead and go for about a minute on and then around 30 seconds rest, however much rest you need until you're ready to go again, okay?
All right.
So we'll do that on both legs, about 5 minutes total, 1 minute on, 1 minute off. And then you're also working on some of your strength as you're standing up and sitting down as you go.
Okay.
So when you're standing on one leg, how are you feeling about your balance?
I feel okay when I'm holding on with my hands, but if I let go, I think I would be pretty wobbly.
Yeah, and that's something else that we can progress on as we go, is as you're regaining balance in both your legs by themselves, maybe you could just hover over or just completely take your hand off. But again, we'll get into being able to do it with having your hand on here for the support that you need, and then as you get stronger, being able to hover and then maybe taking your hand off.
Okay.
Okay, perfect. All right, the last exercise we're gonna do today is a little bit of a 2-in-1. So we were working on walking a little bit earlier. We worked on some of your balance and strength earlier with the bike. And now what we're gonna do is hit a little bit of that balance on 2 legs, as well as work on some of those fine motor movements with your hands. So you said that you've been having a little bit of trouble trying to button your son's pajamas when he goes to sleep at night, right?
Yeah, I have trouble with buttoning things and also typing on my keyboard at work.
Okay, so yeah, this is something that we can do to kind of help some of those small finger movements, just so that you can continue to do that throughout your day.
Okay.
So how we're going to do this is I'm going to ask you to pick out all the pennies in this pile of coins. What you're going to do is you're going to grab each one individually and try to stack them on top of each other in a nice clean pile. So go ahead and do like a couple piles of 5, just like that. And then while we're going, I'm going to have you standing up at the same time. So maybe doing 2 tasks at the same time, you won't get as tired, or you won't feel as tired standing up with your legs.
Okay, sounds good.
All right, let's go ahead and stand up. Good. You feel balanced and good on your feet?
Yeah, I feel like I can stand here for a good while.
Okay. Good. All right, you're going a little bit fast there. So what I'm going to ask you to do this time is try to go a little bit slower. Pick one up, drop it, and try to get it in a straight line. Okay, go for it. Good. Because sometimes when you slow things down, it's a little bit easier to do it.
Okay.
Okay. All right, how do your legs feel standing up? Do you still feel pretty strong?
Yeah, they're getting a little tired.
A little bit tired? Okay, it looks like we've been going for about a minute now, so we can go ahead and take a break.
Okay.
Good. How do your fingers feel?
Definitely more tired from doing this exercise.
Yeah, so it looked like whenever I was looking at your range of motion of your fingers, it looked like they were kind of flexed a little bit like this all the time, and you lost a little bit of the range there.
Mm-hmm.
So something you could do to help stretch it out, you can bring your hand out and stretch out your fingers with your other hand just like this. And
Okay.
hold it, and then let go, and then do it again. So you want to try to stretch for about 30 seconds at a time. And if it gets a little hard to pull right here, you can also do it on the table like this.
Okay.
Yeah, so while we're kind of taking a stretch break here, I'm going to talk to you about your home exercise program that I wrote you. So we're doing all these exercises and doing lots of treatment and therapy, but what's really going to help to get you results and doing what you want to do is really adhering to your exercise program that I'm going to give you. So it's going to include a bunch of different exercises and stretches that you can do at home. And that's really going to help you to, again, get back to what you want to do. All right, so go ahead, and how do your fingers feel after stretching a little bit?
They feel better after doing the exercise and stretching. It feels
Yeah.
like I could do it again.
Yeah, and that's something you could do in the middle of the day when you're typing, your fingers are getting tired. Again, just like we were talking about energy conservation earlier, you could take a break, rest a little bit, and then stretch it out.
Okay, sounds good.
All right.